So for those of you just joining, we will get started in just a few minutes. All right, so we can get started. This is the 10th webinar for the post-active treatment surveillance in prostate cancer special study. The study progress as of today is, so we have the number of patients submitted as eligible as 2,449. The number of sites that have completed the study is 81. And the number of sites still working is 743. And the number of sites that have not started is 321. So we hope as the study goes on, we'll be posting this slide and the numbers will decrease for the sites still working and haven't started, and they'll increase in the number of sites complete with the study and the patients submitted as eligible. So we just wanted to give everyone an idea of where we are in the study and who's still working and if anyone needs help. So the purpose of the study for patients who have received curative intent prostate cancer treatment to determine whether more frequent PSA testing leads to better survival or more harm for the patient. In order to answer this question, it's important to know every PSA test that the patient had. We want to know exactly how frequently a patient is having PSA tests and to know if the patient has had a recurrence. So that's why it's important to have records from all three physicians. So our goal was to have each site complete 12 patients for the special study. Monitoring for the study so far have shown higher than expected rate of ineligible patients, so our sample size seems to be much lower than initially projected. Only patients who were treated with either radical prostatectomy or radiation for prostate cancer are included in the study. So we made changes to the study modifications which are necessary to reach the projected sample size. So for patient eligibility question number 1, the requirement for medical records will decrease from 5 years to 3 years in the first patient level eligibility criteria question. For is there evidence that medical records are available for this patient for 5 years or until distant recurrence or death? And also the replacement queue will include patients diagnosed in the years 2008 to 2010. So previously, only patients diagnosed between 2005 and 2008 were included in the study. These changes went into effect on Tuesday, May 30th at 11:59 p.m. And if you haven't seen changes to your list since then there won't be any more changes added. We have also updated the instructions version 2 and posted it on our website and the web form, and these will not be mailed out. We'll only have these available electronically. So changes to the eligibility, we have also extended the deadline to August 28th, 2017. Sites that completed the study prior to May 30th will not be affected, and the 2008 to 2010 patients only affect the replacement queue when a patient is submitted as ineligible. Previously submitted cases will still count towards the 12 total. Additional cases have already been added if the site had less than 12 patients, but sites are not required to submit more than 12 patients. Individual email notifications will not be sent out to a site that completed the study. So if you have the 12 patients at the bottom of your list for the submitted patients, then you are complete with the study, and we will not be emailing you to confirm. So we appreciate everyone who's asked questions so far. They've really helped with other registrars, and we are really happy for the people who are asking questions. Many questions relate to, is this patient eligible? So what if a PCP is identified but never did the PSA workup? So if you have a PCP and you need all of the records for that patient to be eligible for 3 years, so if you know that they never did PSAs, then that's a complete record. But if the PCP's office responds but the urologist's office does not respond, that patient is not eligible because we need records from both the PCP and the urologist. PCPs may have checked PSAs, biopsies, scans, and others, and it would be important to enter all of this information if the PCP checked these items that are relevant to the study. So the key question is, do you feel you are able to record all the PSAs a patient has had after treatment? 3 years is required for a patient to be eligible, and once they are eligible, we ask for 8 years of follow-up. So you need to have a complete record for 3 years, but then please enter whatever information you have between 3 and 8 years. For eligibility criteria, there's 3 questions. Evidence that medical records are available for the patient for 3 consecutive years or until distant recurrence or death, whichever is first. And then for patients who received primary radical prostatectomy, the patient's urologist and primary care physician can be identified. And for patients who received primary radiotherapy, the patient's radiation oncologist and urologist and primary care physician can be identified. The patient has at least 1 PSA test result within 2 years after the end of the primary treatment, and the registrar is confident in capturing PSA information for 2 years after primary treatment completion. So if any eligibility question is answered no and is submitted, a new patient should automatically be added to the list once the page is refreshed. So please wait at least 2 weeks to hear back from the outside offices for records, and please mark the patient ineligible if the outside office does not respond after multiple requests. If the patient does not have a PCP, then the patient is eligible, but if you do not know if the patient has a PCP or if the patient has a PCP but you are not able to get the records, then this patient is not eligible. A complete record for 3 years is needed for patients to be eligible. However, it is possible that some patients did not have PSAs every year. So we've been getting questions about, we have all the records, but they didn't have a PCP in the 2nd year. That's fine. As long as you have all of the records, they're still eligible. Only the questions on the web form are the required information for the study. And patients receiving care at the VA, so Veterans Affairs, for prostate cancer or prostate cancer follow-up are not eligible. So for pathologic T and pathologic N, the web form will not allow answers to be left blank. So please use Ford's 2016, pages 166 to 167. Please code as 88 if the pathologic T and pathologic N were not recorded instead of leaving blank. So if there was an error and it's supposed to be entered as blank, as not recorded, and you need to update it, even though the web form, it should be blank, the web form won't allow this, so please enter 88. So for PSA, enter PSAs until the time of distant recurrence or death or until the end of the surveillance period, not at biochemical recurrence. Please run the results to the nearest tenth. Registrars should follow the Ford's manual. So for example, for a PSA of 1.2, the registrar can enter 0, 1, 2, or just 1, 2. Numerically, these are identical numbers and will not affect the study or data analysis. Except when a patient has a result of less than 0.03 or less than 0.01 or less than 0.2 or less than some number, please enter the result as 0 for this special study. In this sole instance, we differ from the Ford's manual, and the example was given in the instructions to specifically show this. So testosterone values of less than 20 picograms per deciliter should be entered as 0, and testosterone tests might not be collected for a patient during the surveillance period, and that is fine. Scans that are clearly not related to prostate cancer or prostate cancer recurrence anywhere in the body do not need to be entered. If you're not sure about whether a scan should be entered, please err on the side of entering. For example, bladder scans for residual do not need to be added to the scans. Only scans for purposes of detecting prostate cancer or prostate cancer recurrence anywhere in the body need to be entered. When the doctor indicates possible recurrence and a treatment starts, this should be considered a recurrence. So the date of the recurrence should be the date of the doctor's note. And if the doctor never says anything in their notes, but the patient starts treatment, then we would ask that you put the treatment start date as the date of recurrence. The term salvage radiotherapy indicates a recurrence. And after definitive radiation treatment, if cancer is shown in the TUR pathology, please record as a local recurrence. So for additional clinical information, if the pathology report states suspicious for LVI, enter as no. There is no response for suspicious in the study, so please categorize as no. Please only use the surgical pathology report. If perineural invasion was found on the biopsy report but not the surgical pathology report, please enter no. If the surgical pathology report does not mention LVI or perineural invasion, please enter unknown. So all instructions in the special study instructions document are for the special study only. Boards should be used for routine data collection for the NCDB. Specifically, the instructions for coding biochemical recurrence and patients who are never disease-free instructions differ from the Ford's definitions and are only for the special study. Do not update the NCDB with recurrence differences. We realize this is different from Ford's. So if you find a patient has had a recurrence by Ford's definitions and that recurrence was not previously recorded in the NCDB, please update the patient's NCDB record with that information. So if error messages appear when using the data links credentials when logging into the web form, please use the lowercase if there is a capital in the password. Once a case is submitted as ineligible, it will automatically be replaced and will not appear on the patient list. If there are problems submitting a patient, please make sure the questions at the bottom of the PSA and SCAM tabs are answered, because sometimes people often overlook those questions. If changes need to be made to a submitted patient, you should email specialstudy@fax.org and include the special study IDs and PINs in all communication. So this is our study communication slide. So we are posting information on the special study website, on the cancer forum, and the standards resource library. And we would ask that you please send all study-related questions to specialstudy@fax.org. Study-related questions sent to personal fax accounts will be forwarded to the special study address. So either send an email through the contact form of the web form or email the specialstudy@fax.org email address. Please do not send both, as all emails go to the same account, and please include PINs in all communication. Emails for the special study are being sent from the specialstudy@fax.org email address through an outside server. If you have not been receiving these emails, send the following information to your IT department and ask them to put us on the whitelist. So, and then we have the IP address listed here. This is our slide for the NCRA program recognition information for the continuing education credit. So far all the webinars have been worth 1 credit, and today's is 2017-063. So updated instructions document version 2 is available on the study website and the Cancer Forum. Questions from previous webinars and the Cancer Forum will be included on all webinars. Frequently asked questions document will be posted on the website, the Cancer Forum, and the web form. Most of all the resources are on our website under instructions and resources, and their links will be below. So now you will review the frequently asked questions from the previous webinars. So should data collection be stopped if the patient has a new primary? So the instructions state that we want you to keep collecting data even if a patient has a new primary. You should stop collecting data after 8 years from the surveillance start date or until distant recurrence or death, whichever is first. So please note that records do not need to be kept after the patients are submitted. What should be documented when a physician states a biochemical recurrence? We ask that you please mark this as the date of the first recurrence by any method. Local, regional, and distant recurrences have specific definitions in the manual. If the biochemical recurrence does not meet those definitions, do not enter the biochemical recurrence as a local recurrence if it doesn't meet the definition. So what PSA level should be used to classify a patient as having a recurrence? We are not asking registrars to interpret PSA results. Please record recurrence if the clinical notes indicate a recurrence and if the patient received treatment for recurrence. So does the patient have a recurrence if he was never disease-free after treatment? For the special study only, we are calling never disease-free as having a recurrence. So please record the date of the first PSA test after the primary treatment as the date of recurrence. Never disease-free can be noted as progression of disease or persistent disease after treatment. So if there is a patient that was enrolled in a clinical trial after a biochemical recurrence, how should you code a clinical trial if you don't exactly know what the treatment type is? We would say, please code this as other types of treatment for recurrence. If the urologist and the primary care provider are retired, please see if it's possible to collect the records from their offices. Often physicians may have retired, but the records are still available. All NPIs are required for each provider that saw the patient during the surveillance period, and that is on the surveillance tab. So if the NPI on the surveillance tab is unknown, we ask that you enter zeros if there is no provider, nines if they have the provider but the NPI is completely unknown, or sevens if it's unknown whether they have this provider. So comparing what information the NCDB tab has for a patient to what the medical record contains, there is more information available in the medical records than was initially abstracted. This is especially true for Gleason on prostatectomies and date of last contact. Please select no and fill in the most updated information. We are looking for the most current data, and please use Ford's Manual version 2016. So please note if the NCDB fields are blank, please enter the correct information. Some fields were not collected until 2010. Allowable values for Gleason patterns are 1 through 5 and 9 for unknown, which is different from Ford. Okay, and then I will go back to the contact page. And now it's time to answer questions that have been asked today. So can a supervised non-CTR complete the study? Yes, they can help with collecting records, but a CTR needs to enter the data. So there's a question, can you offer any guidance as to when to submit cases as not being eligible if you've been waiting for weeks to receive records from providers' offices for the large majority of the cases after calling, emailing, and faxing, and they are unresponsive? Or if they have to take them from the archives, then we usually just recommend waiting at least 2 weeks. And if you're unable to get the records after 2 weeks after multiple tries, then we would say to mark those patients as ineligible. So how are you supposed to enter when no biopsy was performed the number of cores which contain a cancer diagnosis? If a patient was diagnosed on TURP and then went to prostatectomy, you can enter 0 on the number of cores taken, but it won't let you enter 0 on the number of cores positive. Please enter unknown. So if you only have 7 years of follow-up data, that's fine. As long as you have 3 years, the patient is still eligible, and we would ask that you please enter as much data as you have between 3 and 8 years. So 2 years of PSA instead of 3 years is not eligible, and that's correct. You need to have 3 years of complete records to be eligible. It's possible that you get a complete record, but the patient may not have a PSA every year, and in that case, the patient would be eligible. The only case where the urologist can be entered as the PCP is if the urologist is the PCP, but that is a very uncommon situation. So if you're unable to get the records from the PCP, then the patient is not eligible. So if a patient was diagnosed at the VA and referred to your facility for radiation, the patient is not eligible.
Eileen, there were a couple of questions that I am not sure the answer to, so I have not been able to answer. Can you take a look at them real quick?
Yes. So for what we said about recording 88, Boards does not say to record 88 instead of blank. 88 is for not applicable, so meaning the site or histology doesn't have the staging schema. But blank is the correct coding for unknown. We are aware of this, but there's no way the web form will allow you to enter a blank answer. So we're just saying, just for this study, special study only, to enter 88 instead of blank. So that's correct that for purposes of the study, we want 88 to mean blank. So if you submit all 12 cases before the deadline, will you know if the case is past the eligibility criteria? So the patient addition process is instantaneous. Once you mark any patient as ineligible, you'll automatically get a new patient instantly without any waiting. If there's any issues, feel free to contact specialstudy@fax.org. And the eligibility questions are at the registrar level. So if they pass the registrar level eligibility criteria, then we are considering those patients as eligible. There is not any further COC eligibility criteria because we've already selected the patients on the back end before you even received your patient list. So there's no COC eligibility criteria once the patient is submitted. So if you've submitted all your patients for the study, do you still need to attend the webinars? It might, unless you need the NCRA credit for the webinars, it's not really necessary if you're complete with the study. So in the instructions manual, we recommend that you review the clinical and consultation notes to see if the physician has indicated an intended total duration of hormone therapy. For example, often with radiation therapy, there may be an intent to give 6 months or 24 months of hormone therapy, and these are just examples. So please look for the intended total duration of hormone therapy. So there's a question about if the most current information differs from what was originally submitted, do you need to update the NCDB record in addition to the special study record? We ask that you update the special study record and then do not update the NCDB record unless there's something wrong from what was initially extracted. So the special study instructions are for the special study only unless if you see a discrepancy with what was entered according to the NCDB instructions. So the PSAs do not need to be entered before the surveillance period, which starts on the surveillance start date, which is either the date of the prostatectomy or the end date of radiation. So if there are no notes that are found in the patient's record regarding the duration of hormone therapy, what should be entered? We would say please enter unknown for the duration. So the 3 years for eligibility needs to be consecutive records starting from the surveillance start date, which is the date of the prostatectomy, or the end date of radiation, whichever is closer to the date of diagnosis. So the 3 years cannot have any breaks in it. So if all of your patients are with one urology group and they have not authorized you to access to the patient chart, we would ask you to see if they are willing to try a few patients instead of all of them, especially patients who are diagnosed more recently. And then if that doesn't work, see if you have any radiation patients who are not part of that urology group. So patients that have follow-up at the VA and the DOD are not eligible, and also sites, pediatric sites, are also not included in the study. So even if you have PSAs from year 3 to year 8, you would still need the PSAs from years 1 to 3 to be eligible. So 0.93 PSA should be entered as, so first you would round it to 0.9, 1 decimal point, and then please enter 9. So if you don't have records from the PCP, but the radiation oncologist has done the PSA testing for the patient from year 1.
Eileen, I think there was actually there was a subsequent follow-up question, so we can just skip this one because it needs a kind of a repeated discussion. So.
Okay.
One thing I do want to mention, and just I think to give everybody a heads up, I don't know if an email has been sent, but there are a couple of upcoming webinars that we are canceling, one because of July 4th holiday, and also we've had some discussions about some of the future webinars being shortened to be less than an hour. Do you want to talk about that real quick? Just give everybody a heads up.
Sure. So we'll be sending out an email, but the webinars on July 4th and July 11th will be canceled, and starting June 27th, the webinars will be 30 minutes long and worth 0.5 credits of CE.
I think part of the reason for shortening is because I think now that most people have really are pretty far into this study, and the questions that we're seeing are pretty much very similar and not a lot of new questions, I think this will just allow everybody to save some time on the weekly basis.
So the surveillance period ends at the time of metastatic recurrence. Instructions version 2 can be found on the web form. Up next to the Contact Us button, there should be a link to the instructions too, and also on the study website, which is actually on the slide showing now. So if you have 3 years of consecutive notes, but one PSA is not done for one of the consecutive years, are they eligible? So if you have the complete record for the 3 years, the patient is still eligible even though they didn't have the PSA in one of the years, because that means that you have all the records, but they just didn't have a PSA that year, and that's fine. So if the PCP had no follow-up records in their office, and they did not see the patient at all during the surveillance period, then the patient is still eligible. So if you're having problems saving, we would ask that you email specialstudy@fax.org, and we will look into it. So how are you scored for doing the study at the time of the COC survey? Are you automatically compliant with the standard for submitting cases for the study? Yes. Once the study is over, we will post who is compliant and who is not compliant, and then you will receive credit or not for the standard. So you would need both the PCP and the urologist for a patient to be eligible. So if the PCP did not see the patient at all during the surveillance period, that is okay. The patient is eligible. But if you know that the PCP saw the patient and you can't get the records, the patient is ineligible. Even if the recurrence takes place 1 year later, the patient is still eligible. So even once they have a recurrence, you still need to enter PSAs. The surveillance period is defined on page 3 in the instructions and ends at 8 years, the patient death or distant metastasis, whichever is first. So if you do not complete the study, then you will be non-compliant for the standard by the study deadline. So in the notes, if the urologist indicates the date and the name of the hormone but no intent, then please enter unknown option for the intended duration. So right now we have reached the end of the questions asked so far, so we'll stay on the line if anyone has more questions. So if there is no tent of duration in the urology notes of hormone therapy, please enter unknown. On the instruction manual, this should be 999. So that is correct. If other than, is there any other factor that would make the facility not compliant other than completing the study by 8/28? If you complete the study by the deadline, you will receive credit. Um, if you have any other specific reasons in mind, then just email us and let us know and we can confirm with you. But if you complete the study by the deadline, you will be compliant and receive credit for standard 5.7. So if you have less than 12 eligible patients and you complete that, you are still compliant. So I think that's all the time we have for today. We will see everyone next week at the same time. Thanks for asking all your questions, and if you have any more, just email specialstudy@vax.org. Thanks.